Hi, I'm Dr. Schindler, and I'm here to talk to you about peripheral neuropathy. You suffer from pain and numbness, tingling and burning in your hands or feet, being treated without success, been told to live with it, tired of taking drugs that don't fix the problem? Discover in this 10-minute video how our unique neurometabolic rehabilitation program can help change your life. Our next peripheral neuropathy seminar will be held on December 18th at 12:30 p.m. Seating is limited, so call today and discover how this 1-hour seminar can change your life. Peripheral neuropathy is the term used to describe disorders of the peripheral nerves. Even though 10 to 15 million people in the U.S. suffer from peripheral neuropathy, and the information is hard to come by. Approximately 50%, that's 50% of diabetics will develop this condition. Many people that use statin drugs, meaning like cholesterol drugs, will be affected by this mysterious and under-recognized malady. Neuropathy means disease or abnormality of the nervous system, which is not a very helpful definition. We need to think of neuropathy as any damage to the nervous system. Carpal tunnel syndrome, herniated discs, and strokes are the insults to different areas of the nervous system, all with different symptoms. Diabetes is a symptomatic disease that affects all nerves of the body, from the brain, eyes, and the small nerves in the heart and digestive system to the nerves of the hands, feet, and legs. The peripheral nervous system is made up of nerves that branch out, they all branch out the spinal cord, as you see up here, and the different parts of the body. The peripheral nerve cells leave three main parts: cell body, axons, and dendrites, muscle, nerve, junction. And part of the nerve can be affected, but damage to the axons, which are the little portions, are common. The axon transmits signals from the nerve cell or the nerve cells to muscle. Most axons are surrounded by the substance called myelin. It's like a sheet, which facilitates the signal transmission. There are two types of symptoms with peripheral neuropathy: positive and negative. The negative signs, which come first, are when damage to the nervous system obviously bring about a loss of particular function. For example, loss of reflexes, remember those? Loss of strength, loss of sensation like numbness, but these are rarely detectable to the patient because the brain makes up for the different losses. Only after some time do the sick and damaged nerves develop the positive signs of neuropathy. Tingling, burning, biting, stabbing, shooting pains. This too is a reaction of the brain and the nervous system. Unfortunately, this overreaction tears apart the fiber that the patient lives. Each patient will describe their pain in their own individual language of pain. This can easily confuse a doctor not trained in recognition of treatment of these patients, so the patient usually continues to suffer, going from doctor to stronger and stronger doses of pain pills until they are either completely drugged up and out of it or lost in their own world of suffering. Some neuropathies come on suddenly. Others take many, many years. Some people are affected only by the weakness in the arms and the legs, which leads to difficulty in standing, walking, or getting out of a chair. The loss of sensation in the feet, ankles, and toes contributes to the patients not having a good sense of where their feet are in space, touching the ground, and this causes them to fall very easily. These under-recognized sensory losses can only be detected with proper clinical exam. My office has the necessary tools to uncover the underlying causes of the secret, silent nerve damage. Some patients will eventually become unable to walk at all. Others start with a tingling, pin-pricking feeling that turns into deep, sharp pains and burning electric shocks. These debilitating problems can only be at their worst at night while trying to get to sleep because the pain never goes away. In fact, once started, it only gets worse. Currently, ordinary medicine has no cure for peripheral neuropathy. The extremely powerful drugs dispensed to patients do not treat the nerve damage. They numb the brain to numb the pain. Most patients can not tolerate a drug's existence, but feel they have no other option against this horrifying pain. If you would like to have more information or to set up a consultation with me to see how we can help you or someone you know, give us a call and call us at 847-912-3456. Easy to remember, that's 847-912-3456 to schedule an appointment to see if you are a candidate for these breakthrough procedures. Thank you. I'm Dr. Schindler.